Good evening, Bhavna. Has Dr. Kanika Sood joined?
Yes, ma'am. Hello, good evening.
Hello, ma'am.
Hello, Dr. Kanika Sood. Thank you so much for coming for this webinar. So let
It's
us
my
begin
pleasure.
today. Good afternoon to all my dear Salvanians and the entire extended family, all the parents out there who joined this webinar. We all collectively accord a heartful welcome to Dr. Kanika Sood, who's a senior consultant in Dharamshila Hospital. And today she will be telling us about all those precautions that we need to take, not only to protect our children, but also to look after their health and well being. Can I say at the outset that indubitably this is a pandemic which we were never aware of before? And no wonder it is given a sobriquet of the great unknown. Though I would like to say that perhaps it is the worst unknown. We just do not know anything about it. What we know, though, is very clear, and that is there's hardly a person, not only in India, but around the world, who's left untouched by the ravages caused by this unknown pandemic. The tumult it has caused to people's lives, to the health, well being, and emotional well being, the feeling of safety, the feeling of security. So much has gone from our lives. We just do not know what is happening next, and when we are all emerging out of it. But one thing is for sure, our children are not untouched by this trauma, which they hear about all around them from their parents, from the media reports, from the newspaper, from friends. And that is exactly the reason why we thought of organizing this webinar and call upon Dr. Kanika Sood to throw some light on it. Welcome, Dr. Sood. The audience is all yours now.
Thank you, ma'am. I hope I'm audible clearly.
Yes, you are.
Yes, ma'am.
Yeah, so at the outset, I thank you for giving me this opportunity to talk about the pandemic, because I think as healthcare professionals, we are the ones who are seeing the maximum brunt of it, and we are living with it day in and day out. And we really feel bad when you walk in the streets and see people not following the precautions, despite best of the media telling them that do this, do that. Despite that, people don't follow the norm. So it really pains us. But I think this school is one place from where the message goes loud and clear, and it is followed. Because once the children accept that this is how it has to be, they force their parents to do that. And we have had examples of many things in which we have seen that school has been the educator in terms of educating the parents also. So I really appreciate this special effort which you have taken to educate the parents as well as the children about COVID. So I initially thought I will keep the entire thing an extempore, but I realized I had some pictures to share, which I thought could not be shared unless I have my presentation in place. So I hope you can see
Yes,
my
ma'am.
screen. So this particular season, I think we've had almost, we would celebrate the anniversary of this COVID in Wuhan end of this November. So then why do we want to talk about it? Because there are so many things which have changed in the last 1 year, and the entire government, the entire government chain is sprung it into action in the last 1 week, realizing that the next 3 months are going to be a havoc if we don't reform ourselves. So that is the reason, despite the fact that people know about COVID for the last 8 months and we've been endlessly educating what to do, what not to do, we need to reinforce all those facts again and prepare ourselves even more for the next 3 months. So this is an effort which the CBSE is endorsing through their school chains, so that the message goes to each household that why we need to be more aware in the next 3 months, because COVID is likely to strike in a harder fashion. So I think it's been so much of time, and people would want to think that why are we having a webinar today? What has changed? We know what to do. We know about hand sanitizers. We know about the mask. So what are our concerns? I think few concerns Madam Principal Ma'am has shared, that we all are, sitting as if in shackles and thinking we want to break this chain and go out. When is this going to end? We all are feeling so fatigued, sitting inside our houses, inside our workplaces, not being able to go out. So there is a big question in everybody's mind, when will this end? And the second big question, which I hear day in and day out, is when is the vaccine coming? And people are really hopeful that the day vaccine comes, they are going to come back to normalcy. But I think this vaccine is a dream for us also. There is nothing which is very, very near in the timelines coming onto the pharmacy racks. The first set of vaccine would come into the phase 3 trials by end of this year. And once it clears the phase 3 trials is the time when we would know whether it is efficacious to us, and then we will be using it for public use. So don't wait for the vaccine. Continue to do what you were doing and understand the importance of the next 3 months very, very diligently. So this is a snapshot which I took from the today's curve. So as of now, on today's date, we had 74,383 cases yesterday who were diagnosed new with COVID, and we have a good amount of people who have recovered. But this peak, which is so beautifully going down, is likely to jump up in a magnitude in the next 3 months. That is what is a big concern to the government as well as the healthcare workers, because what we understand is what is happening in the next 3 months, we are heading towards the festival season. And all festivals for all religions, I think most festivities are there in the next 3-4 weeks, and people are likely to come out and they are likely to let down the guard. And that is what is worrisome. And this is what majorly my talk today would be about: why not to let down the guard and what to keep continue doing in the next 3 months to be safe. We cannot have a lockdown of lifetime. We all know that. Our economy is bundling up. There are people who don't have livelihood. They need to earn money to keep their kitchens running. So we cannot shut down things. So the lockdown is not the solution. So now solution is to living in pandemic with our guards up. And that is what we need to learn frequently and keep on reminding ourselves that we have to live like this, despite the fact we are feeling bothered by it, we are fed up with it, but we still have to follow all the norms as diligently as we were doing in March, April, May, or maybe for the 6 months to come. So this again is something which I really wanted to share. The reason for making the presentation was this particular picture, which actually scared me. This is dated of 4th of October of one of the malls in Kolkata. People are just thronging the malls for Durga Puja as if these shoe racks will not have shoes after 5 months or so. And it pains to see where is social distancing? There is nothing called social distancing, and people are wearing masks, believing that the mask will just take care of everything. But look at these masks. Where are these masks? They're hanging below their nose. Practically, most of the masks are as if they have been kidnapped and been gagged by terrorists. They really don't help you for COVID. So this is what is alarming, and this is what we need to take care of. We don't want this happening in Delhi. I'm sure after these pictures must have been shared with the authorities, they must have taken action onto the mall shopkeepers also to allow limited people at a given time. And these are the things we need to adopt. See, we all need to go out. We all need to celebrate festivals. We all need to have rituals to be done. But we have to find a new way of going out. We need to stagger things. We need to define timelines. You need not take your entire family. You just send one person who can get your grocery household, and rather than subjecting everyone to that virus exposure. So that is what needs to be adapted. And that is the mindful consciousness we have to get in the next 4-5 months. So this, I think all the Kingdom of Thrones people know that, yes, winter is coming. Surely winter is coming, but this time the demon is very different from the Kingdom of Thrones. The demon, we all know, it is all around us. So winter is also bad. Next 3 months are also bad in context of the fact that viruses are on surge in winters. So it is scientifically proven, and it has come out from a lot of scientific bodies, that there will be a surge in the winters. Especially in India, we are likely to have the second peak. So the snapshot which I showed you that the peak is going down, it is likely there will be another peak. So chances ये हैं कि जो कोरोना के केस नीचे जा रहे हैं, वो विंटर्स में दोबारा ऊपर आ सकते हैं, क्योंकि सर्दियों में वायरसेस ऐसे भी ज्यादा होते हैं, जुकाम खांसी ज्यादा होते हैं। जितना नजला जुकाम खांसी सर्दियों में होता है उतना गर्मियों में नहीं होता है। सो यू हैव टू बी मोर कॉन्शियस। तो इट इज सेड दैट विंटर्स में इट इज लाइकली टू बी मोर कॉमन। एक तो मौसम की वजह से, दूसरा हमारे बिहेवियरल पैटर्न। So this is another study which has come up from our own Indian organization, who have said that 4 degrees centigrade is the time when the virus will find its sweet spot. मतलब 4 डिग्री पे वायरस को ग्रो करने के लिए ज्यादा मौका मिलेगा। एक तो धूप नहीं आएगी, धूप अपने में एक सैनिटाइजेशन करती है। धूप का एक फंक्शन ये होता है कि वो कीटाणुओं को मारती है। तो विंटर्स में जब धूप की कमी होगी, टेम्परेचर नीचे जाएगा, तो वायरस की मात्रा बढ़ेगी, तो केसेस बढ़ सकते हैं। परसों की जो वक्तव्य आया है एम्स से, वो तो काफी डरावना था। कहा जा रहा है कि शायद दिल्ली में हर दिन 15,000 केस डेली आएंगे। वी हैव रीच्ड to the state that we went down to 600 cases in a day and sprung back to 4,500 cases in a day, and chances are that they may be 15,000 cases per day. So that is what we all are wanting to avoid. तो इससे हमें बचना है अपने बिहेवियरल पैटर्न से। आप वायरस को नहीं बदल सकते, आप मौसम को नहीं बदल सकते, आप त्योहारों को नहीं बदल सकते, पर आप अपने बिहेवियर को, अपने तरीके को बदल सकते हैं, जिससे आप इन त्योहारों को मनाने वाले हैं अगले 3 महीनों में। So we will just walk through certain precautions. I believe most of you know these precautions. I will be just reminding you, or maybe just telling you what mistakes you might be doing while following these precautions. So just be patient to understand what needs to be done in terms of these 3 things which we have been saying. So first of all, understand अनलॉक डजंट मीन पैंडेमिक इज एंडेड। ये नहीं है कि गवर्नमेंट ने शॉप्स खोल दी हैं तो आप भाग के सब शॉप्स में पहुंच जाइए। उन्होंने शॉप्स खोली हैं बिकॉज बिजनेसेस अफेक्ट हो रहे हैं, लोगों के लाइवलीहुड अफेक्ट हो रहे हैं, उनको लोगों का फाइनेंसेस रन करने के लिए उनकी दिनचर्या शुरू करनी है, उनके प्रोफेशन रहे हैं उनमें वापस उनको लेके जाना है ताकि इकोनॉमी रिवाइव हो, लोगों के घर चल सके। बट पैंडेमिक इज स्टिल ऑन एंड इन अ बिगर मैग्नीट्यूड। तो बी मोर माइंडफुल इन योर बिहेवियर। काम करना पड़ेगा, हमें ऐसे ही माहौल में काम करना पड़ेगा जब वायरस हमारे आसपास है, बट आपको थोड़ा सा ज्यादा तैयार होके काम पे जाना पड़ेगा। तो ये 3 चीजें जो गवर्नमेंट कह रही है, वेयर फेस कवर्स, वॉश योर हैंड्स, कीप सेफ डिस्टेंस, इज द मंत्रा। इसके ऊपर कोई मंत्रा है नहीं, बट वी आर नॉट फॉलोइंग द मंत्रा विद द रियल वैल्यूज। हम फेस कवर कर रहे हैं पर सही तरीके से नहीं कर रहे हैं, हाथ धोते हैं पर सही तरीके से या सही समय पर नहीं धो रहे हैं, और डिस्टेंसिंग की तो आपको मैंने पिक्चर्स दिखाई, बिल्कुल ही लोगों ने अनदेखी कर दी है। तो हु इज टू वेयर अ मास्क? Mask has to be on everyone. I sometimes, look at the children playing into the parks. I realize that the younger kids do not have masks on. The mothers have the mask, the elder kids have the mask. The younger kids are left addressed without the mask. Yes, Corona has been very, very friendly to the kids. We are fortunate that बच्चों को उसने बख्शा है, बच्चों से उसने वो जो कह सकते हैं इतना नुकसान नहीं पहुंचाया है, बट स्टिल उनको भी हो सकता है। अगर वो अपने नाक में कीटाणु घर लेके आते हैं तो वो घर के बुजुर्गों को, घर के बाकी मेंबर्स को दे सकते हैं। दे मे एक्ट एज कैरियर्स। तो मास्क आपको छोटे से छोटे बच्चे को भी पहनाना है। मास्क हैज टू बी ऑन एवरीबडी हु गोज आउट ऑफ द हाउस। मास्क पहना है, पर मास्क बस दिखावे के लिए पहना है बिकॉज गवर्नमेंट इज डूइंग certain these challans if you're not wearing masks in your car. So the mask wearing is like just a formality. This is not for people, it is for you. अगर आप मास्क पहन रहे हैं, आप अपनी सेफ्टी के लिए पहन रहे हैं, किसी और के लिए नहीं पहन रहे हैं। तो ये कुछ 6 पिक्चर्स हैं। देखिए, पहली पिक्चर, ज्यादातर लोगों का मास्क ठुड्डी से ऊपर या नाक से नीचे होता है, या नाक पे अगर होता भी है तो नाक पूरा कवर नहीं करता है, नाक के बिल्कुल टिप पे होता है, हवा साइड से एंटर कर रही होती है, या लूज होता है। तो मास्क का फायदा तब है जब वो बिल्कुल हग करता है, आपके चेहरे को बिल्कुल टच करता है। बार बार मास्क उतारना भी नहीं है, बार बार मास्क को छूना भी नहीं है। So I just have a mask for a demo so that I can just show you what people do. So people wear mask, they'll wear a mask which will be like this, और बार बार उसको छूते रहेंगे, बार बार अपनी नाक को टच करते रहेंगे, which I think is the worst practice which we can do by touching our mask again and again, because the outer surface of the mask is the contaminated जो बाहर से कीटाणु हैं वो मास्क की बाहरी सतह पर हैं, अंदर की तरफ से जो मास्क है वो आपके नाक की सिक्रीशन से है। तो अगर आपको मास्क उतारना भी है तो अगर आप इस तरह का मास्क पहन रहे हैं जिसमें लूप्स हैं, तो रादर देन होल्डिंग फ्रॉम हियर, यूज द लूप। लूप वाले मास्क इजीली उतर जाते हैं, लूप का इस्तेमाल करिए मास्क उतारने के लिए। पहली बात तो उतारना नहीं है अननेसेसरली पब्लिक में, it has to be just taken out when you are on your own, when you are entering your household. Otherwise, do not take off the mask in any situation. So this shows how rightly you wear the mask. As I told you, the top edge must rest against the bridge. जो नाक के ऊपर जो ये ब्रिज वाला एरिया होता है वहां पे टच होना चाहिए, यहाँ नहीं पहुंचना चाहिए। चिन को भी कवर करना चाहिए, ठुड्डी से ऊपर नहीं, ठुड्डी के नीचे। इट शुड कवर दी लोअर एस्पेक्ट एंड स्नग होना चाहिए, हवा नहीं साइड से बिल्कुल लूज नहीं लटकना चाहिए। अगर आप उसको उतारते भी हो, जैसे आपने मुझे देखा होगा, मैंने 2 बार मास्क को उतारा, मैंने दोनों बार हैंड सैनिटाइजर से अपने हाथ साफ करे। अगर आपने मास्क को छुआ है, वो एक कंटेमिनेटेड सरफेस है, अपने हाथ आपको क्लीन करने हैं। बहुत बार देखा है, आप देखिए हम लोगों को मास्क की आदत नहीं होती, हम डॉक्टर्स को शायद फिर भी कुछ आदत होती है, ज्यादातर लोगों को मास्क पहनने की आदत नहीं होती, तो वो इरिटेट होते रहते हैं, तो नाक को खुजलाते रहते हैं। अगेन अ बैड प्रैक्टिस। अगर आपको नाक में खुजली हो रही है, आप अपने पास हैंकी या टिश्यू पेपर रखिए, मास्क साइड करिए, नोज हैंकी या टिश्यू पेपर से क्लीन करिए, टिश्यू पेपर है तो डिस्कार्ड करिए, हैंकी है तो घर जाके इवनिंग में वॉश करिए। सो डू नॉट poke your finger repeatedly on your nose, because वो आप टच करेंगे कहीं और, वो सरफेस से कहीं और जाएगा, एंड दैट इज द चेन। हमारे जो नाक और मुंह है वो ही मेन एरियाज हैं जहां से ये वायरस बाहर और अंदर आ रहा है। ऑल्दो आजकल GIT कहते हैं, दस्त भी होते हैं इससे, स्टूल में भी कुछ कहते हैं कि वायरस है, बट मैक्सिमम जो लोगों के कॉन्टैक्ट में चीज आएगी दैट इज योर सलाइवा एंड योर ब्रेथ, सो यू हैव टू टेक केयर ऑफ दैट। And I'll be sharing what can be done for the little ones. Little ones cannot wear masks. I know, understanding being a mother of a young one, I know they cannot hold. So there are some measures. We are getting certain caps with these add-ons where children can wear them. So maybe you have to make some extra effort to either make the child understand that not to touch it, but it is a difficult task. I had given up my hands on making them understand not to touch. So this is one measure I've just exemplified, which you can do to make it sure that the child is not touching, because हम समझते हैं, छोटे बच्चे नहीं समझ पाते हैं। So I believe, I think principal ma'am will agree to the fact कि शायद अगर स्कूल कभी खुले भी नियर फ्यूचर में, तो शायद इन छोटे बच्चों के लिए तो मुश्किल ही होगा, बिकॉज चाहे आप जितना उन्हें सिखा लेंगे, they cannot distance themselves or follow the norms which we are teaching. Next is washing your hands. So preferably if you have soap and water in front of you, washing hands is better than the hand sanitizer. जो ये वायरस है, ये जब हम सोप यूज करते हैं तो उसकी जो सरफेस है वो उसको ब्रेक कर देता है। The surface of the RNA virus is broken by the soap, जो कि सैनिटाइजर ब्रेक नहीं करता है, सोप कर सकता है। So wash your hands frequently if soap and water is there, and there are steps you will find। बहुत सारे आपको इंटरनेट पे पिक्चर्स मिल जाएंगे, बट प्राइमरली आपको हाथ की ऊपर की सरफेस, उंगलियों के बीच में अंगूठा, आपकी हथेलियां, इन सबको साफ करना है लगभग 20 से 25 सेकंड तक, और फिर पानी से आपको धो के दोबारा नाक को छूना नहीं है, हाथ सुखाना है, एंड फिर आपको अपना जो भी है, आपका जो आपको अगर लंच लेना है, डिनर लेना है, जो भी आप प्रोसेस आगे करने वाले हैं वो फॉलो करने हैं। तो फ्रीक्वेंटली हाथ वॉश करिए। शुरू में हम लोग कह रहे थे कम से कम 6 से 8 मिनट पे, या लगभग हर आधे घंटे में, खासकर हम लोग जो बाहर निकल रहे हैं हमें बार बार हाथ धोना है। घर के अंदर डेफिनेटली आप एक बार जब एंटर कर रहे हैं, और एक नॉर्मली भी हर इंसान को खाना खाने से पहले जो हाथ धोने चाहिए, वॉशरूम यूज करने के बाद हाथ धोने चाहिए, ये 8 स्टेप्स जरूर फॉलो करने चाहिए। If you cannot have access to soap and water, then keep some handy sanitizers with you. So there are plentiful in the market. You can even, load in your own bottles, get a bigger bottle at home and carry small amounts into your bag. Whenever you're touching any door handle, वैसे तो कुछ टिश्यू पेपर्स या वाइप्स रख लीजिए, हैंडल को उसी से खोला, बाद में डिस्कार्ड कर दिया। बट इन केस यू हैव टू टच अ डोर हैंडल, यू हैव टच्ड अ रेल, सैनिटाइज योर हैंड्स। आपने किसी से पेन ले लिया, आपने उसको यूज किया, उसके बाद अपने हैंड्स आप सैनिटाइज कर लीजिए, बिकॉज इन सर्फेसिस के ऊपर वायरसेस एक से दूसरे व्यक्ति तक जा सकते हैं। And if you are having some offices where you think there are a lot of people, you can have certain public dispensers. There are some machinery, you can fill in the dispenser with the hand sanitizer. आपको उसमें touch भी नहीं करना है, it automatically gives you the dispensers. I think in the schools these measures will have to be taken, because there will be a more footfall into these areas. So individual dispensers is tedious, so public dispensers can be put into place. Then you have to change your work etiquettes. So all of us, especially the working people, and subsequently most of us are going to start off into the workplace in sometime in the future. We have to follow certain norms. So when you're in your public place, even if you are with your friends, do not pull your mask down. ठीक है, आपको लगता है आपके दोस्त को कोविड नहीं है, बट वो आपके अंदर की थॉट है, आपको नहीं पता है कि किसके अंदर क्या चल रहा है. So even when you are with your own friends, do not put your masks down. Do not eat in groups. आप झुंड में खाना ना खाएं. Try to stagger. Like if there are 20 people who are to eat, you divide the lunchtime into 3 parts, like first 5 with the distance and the next, because maximum aerosol will be formed when you are eating. You are likely to exhale into the environment more than when you are doing for cycling or even biking. So eat either individually or stagger your lunches so that a lot of people don't eat together. Avoid parties. जितने birthday celebrations हैं अगले साल कर लेंगे. ये साल अच्छे से निकल जाए. भाई दोस्ती mohabbat, party, I think these words hold true in your heart. Tell your friends, we are really happy for you if you have certain parties to be attended, but I think humbly refuse and say, next year we will party hard once we are out of this pandemic. So avoid going to the parties, because any gathering, any congregation is likely to increase your risks of getting this disease. When you're going out, like I think a lot of us from the teaching side as well as the other professions are going out now because of the unlock, try to wear those clothes which are washable, because you should not be carrying the contaminated clothes into your closets. So घर जाते ही सर से पैर तक स्नान लीजिए, अपने कपड़े धोइए खोलते हुए थोड़े से गर्म पानी में सोपी वाटर के साथ और सूखने डाल दीजिए. So wear washable clothes. Try to not bring in your footwear into your houses, which can again carry germs. And I think these are things which our elders always followed. This is something which COVID has just reminded, that we should not get any external germs into our house. बुजुर्ग लोग पहले से हमेशा कहते थे रात को पैर धो के बिस्तर में आओ, आप हाथ धो के अंदर आओ, या घर आके पहले अपने हाथ मुंह धो, तब तक आप कुछ नहीं आपको खाने को मिलता था जब तक आप अपने को पूरा क्लीन करके नहीं आते थे. And never used to be a time when footwear used to come into our houses. But I think this corona is a reminder to us to understand the simplicity of life as well as the hygiene, which was always taught to us by our grandparents, our parents, but we have suddenly forgotten over years. And my biggest fear is we may not forget it again. I hope we continue to use these hygienic measures for lifelong. अगर ये कल्चर हमें परमानेंट आ जाए तो शायद हमारी इंडियन पॉपुलेशन में डायरिया, वायरल इन्फेक्शन, बहुत सारी इन्फेक्शियस डिजीजेस ऐसे ही कम हो जाएंगे अगर हम ये लाइफस्टाइल परमानेंट अडॉप्ट कर लेते हैं. Then do not carry a lot of bags to your workplace, because as much stuff you take with you, the more fomites you're likely to bring. So minimalistic is what is the word of the day. बिल्कुल मिनिमम सामान लेके जाइए, और अपने डेस्क वगैरह पे भी बहुत फ्लैटरिंग मत करिए. मिनिमम सामान रखिए जिसे आप सैनिटाइज कर सकें. डेली आप अपने डेस्क वर्क प्लेस को क्लीन करिए. देयर आर ईदर यू कैन यूज H2O2 बेस्ड सर्टेन डिसइंफेक्टेंट, dilute करके बनाए जा सकते हैं. You may find some across on the with the vendors also. Clean your workplace also, and also keep cleaning your door handles and knobs in the workplace, because many people come and touch them. घर पे भी जो आपके बाहर के दरवाजे खिड़कियां हैं जहाँ पे बहुत लोग बार बार आके हाथ लगा रहे हैं, उनको क्लीन रखिए, सैनिटाइज रखिए. Use of elevators. I think this is one, again, a potential area where people don't know how to use lifts. So this is one of the example I've taken from my own workplace. आप देखेंगे तो यहाँ पैर के चिन्ह बनाए गए हैं कि आपको कैसे खड़े होना है. जब आप लिफ्ट में खड़े हो रहे हैं तो आप एक दूसरे की तरफ पीठ करके खड़े होइए, आमने सामने मत खड़े होइए. आप अपने, अगर आपके वर्क प्लेस पे लिफ्ट नहीं है, आप अपने अपार्टमेंट्स में लिफ्ट यूज कर रहे हैं, पहले तो कोशिश करिए, यदि 1, 2, 3 फ्लोर ही हैं तो अगर आप चल के जा सकें तो बेहतर है. नहीं तो अगर आप जाते भी हैं तो क्राउडेड लिफ्ट में ना जाके वेट फॉर some time, go in a more secluded lift, or do not face to face, turn around your backs, and with your backs towards each other, it is more safer, because आपका aerosol आमने सामने टकराएंगे नहीं. So this is what you need to do in your elevator. And I think we had very nice pictures right in the initial pandemics where people had sent pictures how to use the buttons of the lift. So people had toothpicks, or people had small buttons, pens hanging there, that just use that. So I think these are small measures which you can take to prevent contamination of your hands. So be very mindful when we are going out. Then this, I think one thing more, I think we have understood in this pandemic, that life is going to be virtual for a long time. And it is the order of the day. So get apprised of this technology. I think our children have become much more smarter than us in this context. Secondary to these online classes, I have had experiences where my children have taught me to use Google Meet or to host something because they know better. So be mindful in learning these also, क्योंकि ये अब बहुत लंबे समय तक चलने वाला है, क्योंकि आपको फेस टू फेस मीटिंग्स अवॉइड करनी है. आप वर्क प्लेस पे भी कोशिश करिए कि अगर आपकी मीटिंग्स इन पोर्टल्स जैसे टीम, जूम, गूगल मीट पे हो पाए तो बेहतर है, क्योंकि उसमें भी मीटिंग्स में आप चाय कॉफी भी मंगाएंगे, आप मास्क नीचे भी करेंगे. इससे अच्छा है कि आप ऐसे ही पोर्टल्स पे मीटिंग करिए और समझें कि ये लंबा चलने वाला है. सो बी माइंडफुल. और ये सीबीएसई और गवर्नमेंट भी चाहती है कि हमें इन टेक्नोलॉजी वाली चीजों के बारे में ज्ञान बढ़े, बिकॉज अब हम चाहते हैं कि हमारी कॉन्टैक्टलेस ट्रांजैक्शंस हो, हम बैंक्स में कम जाएं. अगर आप टेक्नोलॉजी ओरिएंटेड हैं तो आप अपनी बैंकिंग घर से कर सकते हैं, अननेसेसरी आपके विजिट्स बाहर के कम हो जाएंगे, आप मर्चेंडाइज घर से कर सकते हैं, आप कैशलेस ट्रांजैक्शंस बिना किसी को हाथ में नोट पकड़ाए कर सकते हैं. तो दिस अगेन इज समथिंग विच गवर्नमेंट वांट्स अस टू डू फॉर द नेक्स्ट 3 months, क्योंकि जब आप शॉपिंग्स करेंगे तो डेफिनेटली आप की ट्रांजैक्शंस होंगी, आप नोट पकड़ाएंगे, लेंगे, तो उनको आप सैनिटाइज नहीं कर सकते हैं. आप कितनी देर तक कितना क्या क्या सैनिटाइज करेंगे. सो ट्राई टू यूज दी portals where you can safely do your payments and all through the technology based apps. So this again something which is being endorsed by the government. They have even created so many portals to ease out your way of payments. People have deferred things or may have made installments for things so that you don't have to go there and meet the persons in the bank to get your transactions done. So please be familiar to them and take help of your children. I would say they are going to teach you 10 more things than you would know in terms of technology. Thanks to our teachers, I would say there. So also practice safe food habits. I think all of us now know that whenever you're carrying grocery back home, you have to clean it. तो आप घर जाके जब भी आप अपनी ग्रोसरी लेके जाते हैं, जो भी आपके पेरिशेबल फूड आइटम्स हैं उनको अच्छे से साफ करिए. देयर हैव बीन अ लॉट ऑफ नोशंस, कुछ कहते हैं नमक के पानी से धोइए, कुछ कहते हैं सोडे के पानी से धोइए. इंपॉर्टेंट है कि धोना है. जो सीडीसी या WHO है, इट हैजंट गिवन एनी मंत्रा टू व्हाट इज द बेस्ट वे ऑफ क्लीनिंग योर वेजिटेबल्स. दे से क्लीन द वे यू वर क्लीनिंग देम. तो इट इज इम्पोर्टेंट टू क्लीन देम. दैट इज मोर इम्पोर्टेंट कि आप स्टोर करने से पहले साफ करके सुखा के उन्हें अंदर रखिए. बिल्कुल खराब तरीके से अंदर वैसे ना रखिए, क्योंकि उन्हें 10 लोग हाथ लगाते हैं. हमारे कंटेक्स्ट में हिंदुस्तान में लोग छू छू के सब्जी खरीदते हैं. सो इट हैज बीन टच्ड बाय सो मेनी पीपल. सो प्लीज क्लीन योर वेजिटेबल्स एंड फ्रूट्स बिफोर कंजम्पशन. एंड ट्रैवल भी बहुत कॉशन से करना है, क्योंकि अब लॉकडाउन नहीं है, आप वर्क प्लेस पे जा रहे हैं और आगे जाके धीरे धीरे अनलॉकिंग और ज्यादा खुलेगी, तो आपको पब्लिक ट्रांसपोर्ट को बहुत जुडिशियसली यूज करना है. मेट्रो खुल चुकी है और ये मेट्रो की ही पिक्चर है. लेफ्ट साइड आप देखिए, डिस्टेंसिंग तो है बट मास्क पता नहीं कहाँ गायब हो गए. इफ यू सी दीज टू स्निपेट्स हियर. So this is what Delhi Metro and government is also saying, that sit at a distance and keep wearing your mask. मास्क आपका शील्ड है, वो आपका एक तरह से एक प्रोटेक्टिव मेजर वही है, क्योंकि आपने बहुत देखा होगा, व्हाट्सएप पे भी सर्कुलेट हुए हैं कि अगर दोनों लोगों ने मास्क पहना है तो कोविड होने के चांसेस 70% से कम है. अगर एक ने पहना है तो 50% है. अगर एक ने पहना है और वो अनअफेक्टेड है और दूसरा अफेक्टेड है तो अफेक्टेड पर्सन फिर भी 30% कंटेमिनेट कर सकता है. तो इट इज इम्पोर्टेंट कि सभी मास्क पहने. इस चीज की इंपॉर्टेंस डे इन एंड डे आउट बार बार हाईलाइट की जा रही है. आई थिंक आप फोन उठाते हैं तो पहली चीज अमिताभ बच्चन जी की आवाज में आता है कि मास्क पहनिए. तो उसे इग्नोर नहीं करिए, वो आप ही के हित के लिए बार बार आपको याद दिलाया जा रहा है कि मास्क पहनना जरूरी है. देन व्हाट टू डू विद द मर्चेंडाइज व्हिच लैंड्स ऑन टू योर फ्लोर. अब ऑनलाइन कह दिया मैंने आपको कि कोशिश करिए ना जाइए, मर्चेंडाइज को ऐसे मंगा लीजिए. When you have these merchandise coming to you, just directly don't jump and start opening it. Segregate it. If you can sanitize, if it's in a plastic case, you can wash it or maybe sanitize with a sanitizer. Otherwise, try to keep it in sunlight or in a segregated place for at least 24 hours, because it has been said that probably the virus life on the surfaces is not more than 7 to 8 hours. but there is no sacrosanct data or anything to quantify that yes, 7 hours is good enough. I think we all would prefer to be on the safer side and make more of a time gap before you just open it. If you can put it in sun is the best bleaching agent one God has given us. आप धूप में कोई भी चीज छोड़ते हैं उसके अंदर के कीटाणु कम होने के चांसेस हो जाते हैं। और जो भी आप चीज छूते हैं इस मर्चेंडाइज से, चाहे वो आपके पैकेजेस हैं, कुछ भी है, हाथ आपको उसके बाद जरूर साफ करने हैं। सोप वाटर से साफ करें तो बेहतर रहेगा। अपनी इम्यूनिटी भी इंप्रूव करना है। अब आपने बाहर से अपने आप को बचाने के लिए मास्क पहन लिया, हाथ धो लिए, पर आपके शरीर के अंदर क्या है? आपके शरीर में भगवान ने अगर आपको गेट्स दिए हैं तो अंदर कुछ गेट कीपर्स भी दिए हैं, कुछ द्वारपाल दिए हैं, जिसको हम आपको कहते हैं व्हाइट ब्लड सेल्स। So our white blood cells are responsible for our immunity, and immunity depends on your nourishment. If you are giving a good amount of protein to your body, you are taking antioxidants, your white blood cells are more competent. आपके जो सफेद ब्लड सेल्स होते हैं वो आपके बीमारियों से लड़ने के लिए तैयार किए जाते हैं शरीर में, और इम्यूनिटी आपकी बीमारियों से लड़ने की क्षमता होती है। उस क्षमता को बढ़ाने के लिए आपका खान पान अच्छा होना चाहिए। तो अच्छे का मतलब ये नहीं कि मैं बहुत ढेर सारा खाऊं, अच्छे का मतलब है कि आपकी थाली में हर प्रकार की चीज हो, आप प्रोटीन्स भी लें, फल सब्जियां एडिक्वेट लें। और आजकल आई थिंक जो सबसे ज्यादा जिसको कहते हैं सैड थिंग है वो है कि हल्दी लेना है, काली मिर्च लेना है। यस, scientific evidence है that curcumin and piperine in conjunction are responsible for improving your immunity, and I think our Indian culture has given us spices for centuries. The West looks towards us because they feel we are more immune because our spices give us some amount of immunity. So there is a scientific evidence कि आपको ये चीजें लेनी है। कितनी अमाउंट में लेनी है, nobody has a clear answer to it. कोई मापदंड नहीं है इम्यूनिटी का, और ना ही कोई मापदंड है कि कितना हल्दी लेना है या कितना पिपरिन लेना है, बट ओवरडू कोई नहीं कर सकता है। एक मिनिमम अमाउंट ऑफ जो आपकी डाइट में होने चाहिए, सारे सप्लीमेंट जरूर लीजिए, डेली एक फ्रूट जरूर लीजिए, खासकर कोई कलर्ड फ्रूट एंड वेजिटेबल सीजनल होगा तो आपकी इम्यूनिटी बढ़ाएगा। एक्सरसाइजेस करिए, बिकॉज व्हेन यू एक्सरसाइज योर हार्मोनल वैल्यू इज गुड and your catecholamines are less, your steroid secretion in the body is less. So steroid या catecholamines आपकी immunity decrease करते हैं। तो अगर आप अच्छे से exercise करते हैं at least 180 minutes in a week, deep breathing exercises, प्राणायाम इत्यादि करते हैं, तो आपकी immunity ज्यादा होती है। So quite a lot of people ask me which is the best exercise you think you can be done. So we all know we have to do exercise within the confines of our house. So it is on you, whatever you prefer. You want to do yoga, kids cannot do yoga, so make them maybe dance, make them do Zumba. That is exhilarating, relaxing for them, and diverting also. For the elders, I think yoga and pranayam and stretching exercises would be good enough to give you that amount of stretching as well as immunity. And do not forget about the mental health. I think mental health is the one which is the most affected. Most of us have become wise that yes, physical health is important, are doing some amount of exercise, but because of this pandemic, there are multiple factors which has affected the mental health. कुछ लोगों के दिमाग में कि दिनचर्या कैसे चलेगी, घर बार कैसे चलेगा, people have lost their livelihoods, लोगों के आय के साधन चले गए हैं, तो चिंता सबको है। हमें चिंता है, रोज मरीज देख रहे हैं, घर पे कुछ इन्फेक्शन ना चली जाए, चिंता हमें भी है। टीचर्स को चिंता है, बच्चों को कैसे हम पहुंचाएं एजुकेशन जो राइट टाइम पे जानी चाहिए थी, क्या हम इस ऑनलाइन से कर पा रहे हैं। बच्चों के पेरेंट्स को चिंता है, स्कूल खुल गए तो क्या होगा, या स्कूल नहीं खुले तो हमारे बच्चे कैसे ज्ञान प्राप्त करेंगे। हर एक की चिंता अलग है। So I'm just trying to exemplify that everybody is stressed for some reason or the other. There is that feeling of unknown, which Madam said, Dr. Seema Ma'am herself said that feeling of unknown exists. So you have to find some means to overcome that. See, nobody has the answer कि ये कब तक चलेगा, लंबा चलेगा सबको पता है, बट आपको कुछ करना है जिससे आपके मन की शांति मिले। आप कुछ हॉबीज करिए। आई थिंक इनिशियली सबने रील में किया कि छुट्टियां हैं तो चलिए कुछ नई कला सीख लेते हैं, बट टू give you some mental relaxation, resort to some hobbies, have more family time, talk to the children because they also have their concerns. हमें लगता है कि बच्चे बहुत खुश हैं, स्कूल नहीं जा रहे हैं, their concerns are unique. My little one asked me, why cannot we kill corona by doing a sanitizer rain? And I said, yes, So that means they are thinking all the time, because we talk of COVID all the time. We have news talking of COVID all the time. So these children are being affected. And we don't want then when they grow up, they have this traumatic memory of this year in their mind. So please make things comfortable for them, make them do some recreation, some activity which gives them some relaxation. I think music and dance are two things in which children get the maximum relaxation. So do make them do something or the other which makes them think anything other than COVID. And सारी चीजें COVID के around नहीं rotate करिए. Tell them that ठीक है, it is a time of life. It will also go like everything. जब सूरज निकलता है तो डूबता भी है, रात आती है तो दिन भी होता है. I think we all know that. Our parents have been telling us that सुख के बाद दुख और दुख के बाद सुख, ये एक cycle है. So I think the children need to be told that things will be fine, and someday they are going to meet their friends in school. They will play in the playgrounds, and we will have their happy faces without the masks looking at us. So please take care of mental health, because that is what is affecting. I see in my practice, people are really affected by these issues. Despite the fact they are cured, they are like going into depression. They are not talking to people. They have gone into their cocoons. So please, I think, make an extra effort to take care of your mental health, because it is going to adversely affect your physical health, because it is holistic. दिमाग और शरीर आपस में जुड़े हुए हैं. हमारा दिमाग शरीर से अलग नहीं है. दिमाग शरीर का नियंत्रण करता है. So be aware of that. And do not let this lockdown fatigue come into you. So what is this lockdown fatigue? Lockdown fatigue is कि बहुत हो गया. You are fed up now. People feel कि बहुत हो गया. चलो, this is what happened. People went to Garam Dharam and Sukhdev and whatnot to the GT roads, and that was a havoc. Ultimately, we could see that there were hundreds of people who got infected because they went to the public places and went out and ate. And obviously, when they ate, they had to take the masks down. Nobody can eat with the masks up. So I know we all need breathers, but please hold on to your mettle. कुछ सब्र और. I think सब्र की परीक्षा है, but अगर हमने इस परीक्षा को जीतना है तो आपको अपने आप को और रोकना पड़ेगा कि hold on. We need to just keep the guard on, because we don't want havoc. Because it is said that eating out is riskier than riding even a bike when you're going out into this pandemic. Because थूक गिर रहा है बाहर, saliva गिर रहा है. When you're eating, your mouth is drooling. You're talking, the spit is going to the other person's plate. So don't eat in these groups. Forget about partying or going out in 2020. We will have enough to do in 2021, 2022 if we are holding our mettle in next 5-6 months. So I think this is something which is important. And observe festivals this year with simplicity. We know that the importance of festival is not the grandiosity of the clothes you wear or the amount of gifts you get to your kids or to your friends. Let us just wish everyone good health these festivals. I think that is the best gift we can give to our friends and to our family, because your health and family is supreme. Nothing else can stand. I think this pandemic has taught us nothing else will stand with you. Only your family and your health is only which is going to take you forward. जिन लोगों की इम्यूनिटी अच्छी थी, हेल्दी थे, वो कोविड से भी बाहर निकल आए. The ones who ignored their health, did not take care, even younger ones, they could not make it. So focus on your health and your family. Festivity is not by the goods you get into your house. Festivity is by the happy faces in your family who are around you. It is so gratifying to see everyone hale and hearty and fine around you. Because we hear those horror stories. We know how many people have come to it, and it is traumatic to deal, because people did not even get to see the faces of those loved ones. So I would say that nobody would want to see that day. So please be more cautious in the festival season. Follow all the rituals. Malls में भीड़ मत लगाइए. आपको जो सामान चाहिए आप किसी एक व्यक्ति को भेजिए और रश आवर्स में ना जाइए. अगर वहां रश है तो बाहर से ही लौट आइए. कोई चीज ऐसी कोई चीज किसी के घर में नहीं होगी कि जो पूजा की थाली के लायक ना हो. अगर दिवाली के लिए उन्हें 4 चीजें चाहिए, आई थिंक वो घर में भी मिल जाएंगी. यू नीड नॉट गो आउट टू रिस्क life of yours and your loved ones. I think that is the biggest message this webinar was all about, and that is what the government wants us to be aware of in the next 3 months. And stay informed and updated. I think we all know unnecessarily bahar nahi jana hai. If you have to go out, I have shown you a lot of means and measures what all you have to follow when you're traveling out. Be aware of symptoms. It is just like any other cold, flu. Just a bit of different thing is that loss of taste, loss of smell has been reported very common in it. And some people have just presented with diarrhea. तो कुछ लोगों को तो सिर्फ गला खराब होता है या खांसी होती है या बुखार होता है, पर कुछ लोगों को दस्त भी हुआ है कोविड में. तो अगर आपको कोई भी सिम्टम है जो 2 या 3 दिन से अधिक आपको लग रहा है, तो आपको जाके या तो हेल्पलाइन नंबर जो 1079 है उनको कांटेक्ट करिए या नियरेस्ट हेल्थ केयर पे आप कांटेक्ट करिए, सो दैट टाइमली मेजर्स लिए जा सके. द मोर्टेलिटी, इस बीमारी से मृत्यु के चांसेस बहुत कम है, 3% है, बट हमें नहीं पता वो 3% कौन होने वाले हैं. तो आप सबको सजग रहना है कि अगर सिम्टम्स हैं तो इग्नोर नहीं करना है, डिले भी नहीं करना है, बिकॉज विंटर्स में बहुत कंफ्यूजन रहने वाला है कि क्या ये कोई इन्फ्लुएंजा है या कोई और जुकाम या खांसी है. तो बजाय कि आप खुद के लिए खुद डिसाइड कर लें कि मेरा जुकाम तो नॉर्मल वाला जुकाम है, दिस इज व्हाट आई हियर, मेरा नॉर्मल वाला फीवर है, मेरा कोविड वाला फीवर नहीं है. सो देयर इज नथिंग normal or abnormal about the fever or the COVID or the any other virus. So even the doctor cannot tell you till the time the doctor tests you. So go to the healthcare if you feel there is something wrong, so that appropriate measures can be taken for your well-being and the well-being of the rest of the family, because you might have to isolate yourself from the others in case you do have these symptoms. So be updated. And that is what I have to say. And I would love to take questions. Because I think there would be some questions, understanding the fact that you have to work also and you have to maintain the distancing also. So over to you, ma'am.
Thank you, Dr. Sood, for talking to us regarding the symptoms, precautions, and defensive measures we need to look to fight the COVID monster. Yes, we have a lot of questions in the question and answer section. May I read out a few with your kind permission?
Sure, ma'am.
Yeah. So the most asked question is, can asymptomatic patients spread COVID-19?
Yes, asymptomatic people can also spread COVID-19 because the aerosol generation is even in the person who's not sneezing. The person is breathing in and out. So it is not that he is going to spread it into the volume that would be expected from a symptomatic person, because a sneeze is likely to carry the aerosol for 6 meters, whereas a normal breathe, maybe the confine remains to 1.5. So in that situation, your amount of contact with that person would dictate the risk of you getting COVID from that person.
Oh, thank you so much. The next question is that once if a person is affected with corona, what is the possibility of getting it affected again, and will it be worse than before?
I totally understand the fears with the entire family walking out of it recently. So see, there are antibodies which build into your body. So there have been some research in which they found that, okay, some people had these antibodies remaining for 3 months. Then there came in some studies which said that no, they are there only for 1.5 months. So the science is not clear on to how much protection does COVID give you for a reinfection. Okay. But there are memory cells in our body which do remember the injury which the first COVID caused. So there could be some immunity which hasn't been quantified. But if it happens, it is said that if it happens with a second strain, because you might be immune to a strain which was of a different virulence, the virus might have mutated and caused a reinfection by a different strain. So that possibility theoretically is there. There have been people who have got it second time. And surely when your body is not immune enough, having it for the second time does synergize the side effects of the two hits back to back.
There's already a second wave of corona, which is prevailing in Spain and UK. UK has again gone into a virtual lockdown. So the second wave is as big or as massive as the first wave. So probably India can, in fact, look for some worse cases to come up. So I don't want to do scaremongering, but I just want all the parents to be very cautious of that. That it is very
absolutely Absolutely, ma'am. I totally agree, because this is what happened in Delhi. I think it was publicized also. Oh, Delhi is getting rid of COVID, only 600 cases. And I was skeptical at that time also, because Delhi is not an island. There are people coming into Delhi, there are people going out of Delhi. So there is a migrant population, there are people coming for their work. So there is a lot of in and out into all metropolitan cities. So that second wave was imminent in Delhi, but this winter wave is the one which everyone is fearing. This is what happened in UK, because they have more of a cold weather right setting in even after August. So I think we have to be really scared about it. There is no harm in scaring people. I think because in India, dar hi chalta hai. We don't believe in anything. We believe in God, because we feel that God takes care of everything. And then our second myth is that हमारी immunity तो बहुत है, हम तो street foods खाते हैं, we are, we've had tuberculosis, we've had so many infections, our immunity is higher. Maybe it is, but nobody can measure that. We have no measure to see how much immune a person is. So there's no test which is going to tell you are immune, you are not. So it is better to be scared and safe, rather than being very enthusiastic and then suffering with something which is, really damaging.
So it is fine to believe in God, but also believe in data, because data is absolutely the new, lighthouse for all these issues, particularly like Corona. So we need to be very, very wary of it.
I totally agree, ma'am.
There are many questions, ma'am. I think so. The anxious level has gone up. They are asking, parents are asking, is this virus a retrovirus like HIV?
So it is an RNA virus. It is not a retrovirus. It is a ribonucleic acid virus. So the viruses, they are, corona in itself is a big family. It's a big family of virus. So what we are addressing here is now COVID-19, which is a type of corona.
Okay. Fine. Then they said that, can you tell us about the vaccine? As you mentioned that this is a major question that is coming, that are being developed in our country or abroad till now.
So I think all countries in their own self are trying to build up that vaccine. Indian vaccine also was into testing. We did have news coming in from ICMR that they are going to put it into phase 2 after 15th of August. Then the one from the Oxford has been held on, because they did find that the subjects who tested, who took the vaccine, they had certain neurological problems. So that was put on hold. The Russian vaccine is the one which is talked about most. And it is supposed to reach to India in end of December for phase 3. So basically what happens is, जब आप vaccine बनाते हैं, तो पहले आप देखते हैं that it works in the lab, on animals. Then second phase, you try to see whether you can give it to human beings and whether it is not causing any side effects. So there are multiple phases of these vaccine trials. So ultimately, phase 3 is the one where you find out that yes, it is efficacious, as well as it is safe to be delivered without causing any side effects. So unless phase 3 trials give us results, we still have to, watch and wait for the science to deliver. I think as a educated guess, I may say that nothing before June 2021 or July 2021 is what we foresee.
But even that is an optimist expectation. Even
yes, yes.
One of my science colleagues want to know that how is hypoxia caused by the virus in patient?
So what happens is, this virus, it causes a sort of a clotting. So what we understood over the last 5-6 months is that it produces something called a DIC, disseminated intravascular coagulation. So when it blocks the vessels, the oxygen to the lungs does not go. So it creeps into the vasculature of the organs. So the capacity of oxygen to diffuse from the blood vessels into the lungs and across the exchange, as we know, the respiratory exchange across the pulmonary and the vascular membranes, it is affected. So that is the reason oxygen does not reach and oxygen tends to fall. So initially, when this virus came in, nobody understood what is happening. People were suddenly going, all of a sudden, within hours, So then it came to be understood that there is some clotting going on inside the vessels, which are the micro vessels, which is probably leading to these. And accordingly, the medications have been incorporated into the treatment. So the number of deaths because of these DICs have gone down. So that is the reason for the hypoxia. The diffusion of oxygen into the lungs is going down because of the clottings into the smaller vessels.
Thank you, ma'am. One of the parent, he wants to know that is it true that taking a steam morning and evening will protect us from the virus? Can the steam dislodge the virus from our this mucosal linings? Mucosal, I'm sorry.
So I think this is something which all of us, endorse a lot, that why not take a steam. So I think in one of my slides, I did show you that the virus finds it conducive to grow at somewhere around 4 degrees. So by taking steam, what are you trying to do? The warmth of the steam, you're trying to damage the virus. That is the mind thought which people are having of steam. Otherwise, by and large, when we give steam for any cough and cold, our aim here is to open up the ostia in your sinuses as well as in your nose. So the steam which is being advocated so much during the COVID time, people are thinking that probably the temperature of that steam is likely to damage the RNA, but I think it is totally hypothetical. We really don't have any scientific study to back that by the people who are taking steam every day, the viruses do not go into their body. If it has entered with your nasal secretion, it may have gone into your gut. It may not be just sitting there waiting for you to take steam. So, but still, I think it's not a bad habit. It's a good habit. It does you open up your nasal ostia, your secretions, etc. You can expect to read better because steam tends to loosen the mucus inside your nose as well as your throat. So it is a good practice. I think there's no harm in continue doing it. At least if it does not benefit, it does not harm you at all.
Thank you, ma'am. Ma'am, can you put little light what mask is best to use?
So I think there has been a lot of debate about these masks. So there are simple masks, right? These are the masks. These are the simple masks, which are the simple masks the surgeons used to wear. So if you are not a healthcare professional and you are in the community, I think simple masks are good enough. But if you are visiting a healthcare facility or you are likely to be in contact to somebody who may be afflicted with some cough and cold, then are these N95 masks, which may be helpful. But these are also not sacrosanct. They have their own set of problems because it is not that you bought a mask and then you're using it for 20 days. So then if you are using N95 masks, you buy yourself 4. You label them 1, 2, 3, 4. The one which you're using today, once you've removed it, you leave it in the sunshine for at least 24 hours. Next day use 2. And after you've used the number 4, then bring back to number 1 because it is very expensive. The availability of these masks have become an issue. So ideally, N95 is for healthcare workers. But if you feel that you are likely to go in a place where there is a big rush or more people are likely to be there, then I think it is safe to go with this. But for general public, simple masks have been advocated. And I think we had that mask abhiyan where Modi ji himself said that there's no issue in making your household cloth-based masks also. But I think we really don't have any scientific studies where we have proven that how good they would be in terms of saving us from COVID.
Thank you. The next question I take, ma'am, a parent is asking that how do we make our kids 7 to 9 years old to fight off the mental blocks due to the COVID on their mental and physical limitations?
I think this question really need to understand for all the parents because the kind of trauma, Dr. Sood, many of our children are going through is tremendous.
Yeah.
These days, I meet a lot of class 12 students who come to collect their transfer certificates and school leaving certificates. And I look at them and I ask them how they are. Just a few months back when they were in the school, they looked so different to what they're going through. And it looks as if it's a new person, as if it's a completely different person. So we really need to tell our parents that how to keep our children engaged so that this trauma which they go through is reduced.
I think, ma'am, you in your this dialogue itself answered the question. Engage. I
Engage,
think we need to
yes.
distract them. You need to engage them into something and dialogue. You have to talk to them. So I think what we think is कि हमें तो सब पता है, बच्चों को कुछ पता नहीं चल रहा है. They are playing, they are happy, but they are affected. They listen to us. They see our faces. They can see we are disturbed. They know they cannot go out to play. So we have to talk to them. Even as I told you, even the youngest, even the 3 to 4 year old child needs to be, you know, probed and asked that what are you feeling, how do you feel, what did you do today. So we have to talk to them. I think there is no magical formula, but talking and engaging them into some activities is the only diversion we have as of now. And I think we had a beautiful webinar from the school side. We spoke, it was a good one on mental health. I attended it myself.
Yes. Yeah.
I think so. They just, it was said that you have to just engage your children into some activity or the other, because right now what has happened, I think others would agree with me, that because everything has become online, the children are becoming more into the virtual world more.
Yes,
So,
absolutely.
so what happens is they have their classes, then they have their alternate classes, and they want to study also on them. So they have access to the devices more. So even if you say screen time is over, no, we are studying. So ultimately, we ourselves have got into that trap, and nobody has that answer to how to, come out of it, because they have
Catch
to
20.
do their work.
Catch 20. Yes.
So that further is taking them away from the
Yes.
real world. So we also need to make it sure that their screen time has to be limited. As parents, maybe as teachers, we all have to reinforce to them that talk to people in person, call up, just don't chat. दोस्तों से फोन पे बात करो, talk to them and hear their voices. So at least they feel that yes, my friends are all around me,
Yeah.
and engage them into something or the other. I think there are so many activities we all can do with these children. I think it can be something creative, making something at home which is useful. Now, like we have Diwali, why not make the diyas? Why not decorate the diyas rather than going to the markets? Why not prepare all the decorations at home this time? So if I think if these children are involved into all this and they're looking forward to the festival, at least for some part of the day, they will not think of COVID. They will not think of Corona. So that is how I think we all have to deal with it.
Yeah. Thank you so much.
Another question which is also persistent in my mind is, does spraying people with disinfectant lower the spread of COVID-19?
No, I think right in the beginning of the pandemic, we had these fancy booths coming in where people are walking through them
Yeah.
and they are
Yeah.
sanitized.
Yeah.
So see, that sanitization may take care of the fomites. जो आपकी surface पे body पे clothes पे या आपके हाथ के सामान के ऊपर जो fomites कहते हैं, it may take care of it, but it will not kill the viruses in your nose or in your body. So it's a lot of people invested into these booths which created walk through for sanitization, but they are not foolproof. It is not that the person who's walked out of that wouldn't harbor this virus. He still could harbor that virus. It is just that his touch for some time may become hygienic till the time he has touched his nose or sneezed or coughed. It's just that your surface is clean, but your body still harbors it.
Okay. Now I would like to take up my last question for the session as the time is running. Is it safe, the parent is asking, is it safe for him to donate blood during the coronavirus pandemic?
Yes, absolutely, absolutely. See, all hospitals are maintaining very hygienic environment. The person who comes also is screened. The people who are affected by COVID, there are separate gates for their entries. Even the wards are separate. So from the safety perspective, he is also safe and he can surely donate, because especially with this COVID, people who have especially come out of COVID, we are promoting the plasma donations also. So all measures are taken by all hospitals to make it sure that the people are safe. It is the safety of your travel and the other things which I told you which need to be taken care of. Otherwise, healthcare are taking all due efforts to make it sure that the people who enter to the campus are not affected by the healthcare facility by this virus.
Thank you so much, ma'am. Ma'am, with the rapidly changing landscape of the COVID-19 outbreak, you have addressed the needs and well-being of people, which is on a global public health priority, I think. We are thankful to the Government of India also for launching a country-wide campaign for all schools across the country. I'm sure we are well better prepared to take on the next few months till we have a vaccine against it to protect us all. So on behalf of Salwan family, I extend my heartfelt gratitude to Dr. Sood for sparing her time to be with us in this evening. A very big thanks to the participants for being a wonderful audience, and above all, our respected principal ma'am, who is our pillar of strength and the guiding force behind all our endeavors. Thank you so much, everyone.
Thank you very much, Dr. Sood.
Thank you, ma'am. It was a pleasure being
Thank you very
rubaru with all of you.
much. Thank you very much.
Thank you, ma'am.